Hi, I'm Dwayne Brown. Tonight on KPBS Evening Edition, California's climate change goals are about to get a little more ambitious as Governor Brown signs a sweeping bill to boost renewable energy.
From MRSA to Ebola, the flu, and vaccines, I'm Peggy Pico with the latest on fighting infectious disease from a national conference underway in San Diego. Plus, two international human rights activists share stories of peace building and activism in the Middle East.
And the first of a series of reports tonight on mental illness will look why the county's mental health system still struggles to provide adequate care. KPBS Evening Edition starts right now. Hi, good evening. Thanks for joining us. California is doubling down in its fight against global warming. Governor Jerry Brown signed an ambitious bill today requiring the state generate 50% of its electricity from renewable sources like wind and solar by 2030. Buildings would also need to be twice as energy efficient. A provision to reduce gas use was stripped from the bill after pushback from the oil industry. California already has some of the world's toughest air quality standards. From greenhouse emissions to solar power, a key incentive for California homeowners to install rooftop panels is in danger. Environmentalists staged a protest downtown today. KPBS Metro reporter Andrew Bowen was there.
What do you want? Rooftop solar. When do you want it? Now! I know that. Somebody make some noise.
About 200 people rallied outside the headquarters of Sempra, the parent company of San Diego Gas and Electric.
Fighting for the next generation.
The heart of their message was clear. Fossil fuels are destroying the environment, and renewable energies like solar power are the future.
We need to transition, and we need to transition right now.
A big incentive for solar users is called net metering. Here's how it works. Solar panels on roofs sometimes produce more electricity than what a home actually needs. Net metering allows the homes to sell back extra power to the grid. This makes electricity bills cheaper. Environmentalists say it's one of the most powerful tools to encourage Californians to install solar panels.
Now, a federal tax incentive for solar power is set to expire next year. Activists here say that's all the more reason to keep state incentives in place.
SDG&E has different plans. The more people who install solar panels on their roofs, the less money the power company makes, or the more it needs to charge other customers. That's why they want solar customers to earn less money for the power they generate. The company says the current rates were devised 20 years ago.
Reforming net energy metering is necessary because it's really resulted in some significant cost on our customers who don't have solar, to the tune of today about $8 a month on their energy bill. And if nothing changes, this will grow to $30 a month.
State regulators are coming up with a new version of the net metering program. But neither the protesters nor the utilities know what that program will look like. Until a decision is made, both sides are battling to make their voices heard.
This is not a game.
Andrew Bowen, KPBS News.
Neighbors in Point Loma are challenging the FAA's proposed changes to airlines taking off from Lindbergh Field. KPBS reporter Steve Walsh says it comes just hours before a significant deadline.
Residents don't know how concerned they need to be as the Federal Aviation Administration prepares to adopt new flight patterns which could allow planes to fly over the tip of Point Loma. Several hundred people packed an airport meeting at Liberty Station Tuesday night to question the Southern California Metroplex, which tightens route for 6 major airports, including San Diego.
And they are very aware that we live in a noise environment. We're willing to accept that. The issues are is that it's the additional concentration of the noise that are resulting out of what's going on with the Metroplex effort. Their noise monitoring information is not accurate in the environmental assessment. Therefore, it's really not telling the true story.
Anxious residents believe they already hear the impact of the new routes. FAA officials say none of the changes have gone into effect. Plans won't be finalized until at least May.
Currently, we have the proposal that we tried to show and showed tonight. It's on the website as well, explaining what the proposal is. We are taking comments from the community, and then a decision will be made.
The public has until midnight Thursday to comment on the proposed changes. Steve Walsh, KPBS News.
Opponents of California's right to die law are trying to overturn it. Seniors Against Suicide filed papers today to put a measure on next year's ballot to repeal the law, but the odds are not in their favor. A new field poll out shows 65% of California voters support the idea of doctor-assisted death. The law is set to go into effect next year. It will allow a doctor to provide a lethal dose of drugs to a terminally ill patient upon request. A new Target store is open in the heart of one of San Diego's most tightly knit communities. KPBS reporter Matt Bowler spoke with neighbors and business owners in South Park who are making peace with the idea.
And at first there was a lot of negativity.
That's Mark Chavez, owner of the store So Childish in South Park. Chavez says business owners and neighbors reacted poorly when they heard the Target was opening.
But I think now that things have settled down a little bit, for sure, most of the businesses, I would have to say 90% of the businesses are okay with Target.
Judy Foreman owns the Big Kitchen. She's been living and working in South Park for more than 35 years.
A lot of the neighbors thought we could stop them. I didn't think we could stop them. But I thought what we could do is let them know what we need as a community. And if they could provide that for us, then, maybe we can work together.
The new store's manager, Robert Farrington, says this is just what Target did.
For us, I think it was really just important to educate the community about what we were going to do and make sure that we actually did what we said we were going to do.
The new store has organic produce, a pharmacy, electronics, clothes, and even a sporting goods section. Foreman says, yes, the neighbors and businesses are hoping the new store lives up to its word, but
their Target sign can easily be turned into a peace sign. And they've heard of boycotts, but they've never heard of girl-cots.
Matt Bowler, KPBS News.
What's old will soon be new again. City officials broke ground today on Skyline Hills Library project. There was lots of dirt to be moved in preparation for construction. The facility in southeastern San Diego will replace the old branch library built back in 1969, way before laptops, iPads, and the internet. Councilwoman Myrtle Cole says it will be a vibrant social hub where folks can learn about their community.
It will be filled with access to arts, special collections that grow out of specific community needs. It will provide opportunities for free classes, free tutoring, homework help programs, and help to bridge the economic divide that impacts students' academic performance.
The new Skyline Hills Library will be triple the size of the old one, about 15,000 square feet. The mayor says the $13 million project is the first of many branch library makeovers to come. San Diego's cracking down on people who misuse those blue disabled parking permits. Only police officers were allowed to enforce the use of them, but City Council has approved an ordinance allowing metering officers to write tickets. Council also set a $740 fine for violators. The city estimates 60% of handicap permits are misused. The city's budget committee rejected a plan to set up a pension reserve fund. Mayor Kevin Faulkner's proposal was to set up a special account to cover any unexpected increase in the city's pension payments, but Councilman Todd Gloria and fellow Democrats voted against it, saying the fund was too restrictive and the money would not be available for other uses. The city has cut services in the past due to higher pension payments. Listen to this. In a classic clash of employer versus employee, union officials call in to question a policy at a Sacramento DMV call center. It docks workers' pay when a trip to the bathroom takes longer than 7 minutes. Managers say it was designed to cut the time workers spent away from their desks and off the phones. Employees have filed a grievance. For the first time in 5 years, San Diego County's agriculture value slowed slightly. The 2014 report says the number of acres in production dropped by 12%. Farm Bureau says the drought and rising cost of water could be to blame. Ornamental trees, indoor flowering, and bedding plants are at the top of the most valued crops in the region, followed by avocados, tomatoes, and lemons. Thousands of infectious disease experts are in town this week to address a range of issues from whooping cough to the flu, even new recommendations for treating HIV. Peggy Pico has some highlights.
Top issues at this year's infectious disease conference include fighting MRSA, Ebola, new HIV recommendations, the flu, and vaccinations. Here with the latest research for infectious disease is my guest, Dr. Amish Adalja with the Infectious Disease Society of America. And Dr. Adalja, the Ebola outbreak resulted in 11,000 deaths, 28,000 confirmed cases globally, some here in the U.S. Are we better prepared today to fight Ebola?
We're definitely better prepared than we were when this outbreak started, but we're not all the way there yet. Ebola taught us a lot because this was the biggest outbreak ever, and we saw a lot of things happen. We had healthcare workers getting infected in Texas. We had multiple evacuations. We learned a lot about how to treat Ebola, and we started to fortify our hospitals to be able to care for patients with contagious infectious diseases, but we still have a long ways to go.
Something that happened was this development of this, or at least some investigation into Ebola vaccine. Where does that stand today?
Well, we had some very promising data from an early Ebola vaccine where they showed about 100% protection rate. So that's really, unprecedented. There needs to be some drilling down of the data to make sure that actually holds up. But this vaccine looks very promising, and it may change the face of how we deal with Ebola outbreaks in the future. And we also learned something else about supportive treatment, even without a vaccine. Right. We had Ebola outbreaks in very resource-poor areas of the world where they may have been in a village and there were a handful of cases. This outbreak, because of the resources that were brought to bear, allowed us to actually try some of modern medicine's basic supportive care, like IV fluids. And what we're finding is patients with Ebola are very dehydrated. They have electrolyte abnormalities that can all be corrected with IV fluids and electrolyte supplementation, and that may be all you need to do to actually reduce the mortality rate from what was 90% down to 20 or 30%, and then the experimental drugs and all that can work on top of that. So we really learned a lot about how to treat this disease. When it comes to other infectious diseases here in the U.S., what's the biggest concern? The biggest concern to me is the threat of antibiotic-resistant bacteria. What we're seeing is a gradual spread of bacteria that are resistant to one or multiple antibiotics, and sometimes no antibiotic at all can treat an infection. We are left in the pre-penicillin era. And this is something that was totally predictable and totally preventable if we would use antibiotics a little more judiciously than we have. Not using it for colds and coughs and other viral type illnesses, getting our veterinarians, our dentists, everybody involved in prescribing antibiotics only when they are needed. Do we need to discover new antibiotics? We do need to discover new antibiotics, but we also have to get smarter about how we use the ones we do have. We shouldn't, like I said, be using them for coughs and colds where the majority of patients do get antibiotics. We also need to move beyond antibiotics, think about better vaccines, think about novel strategies to attack the bacteria more specifically. There are actually viruses that we can give people that can kill bacteria. A whole host of new approaches need to be tried. Well, speaking of coughs and colds and things like that, San Diego's flu season peaks in February, so it's now October. Should people here wait to get a flu vaccine or a shot, or does it last? We should get the flu vaccine really at the beginning of fall. So fall has already occurred, so people shouldn't really wait, and they should get the vaccine as soon as they can. Although if you haven't gotten the vaccine, it's December, it's still not too late to get it, but we like to have people getting the vaccine as close to the beginning of fall as possible, and then that should carry on through the rest of the season. And a few days ago, the World Health Organization actually released new recommendations to treat HIV before symptoms start or for pre-exposure treatment. Tell us what that's about. So we know that HIV, the longer it is in your body, the more damage it occurs. And we figured out that the earlier you treat, the better you are able to prevent the late complications of HIV and the longer a person can live. They also can become less infectious. So treatment is actually prevention. So if you're on medications and the virus is completely suppressed, it's very difficult for you to spread it to another individual. So this is all part of how we're trying to really rethink the way we treat HIV and getting people tested and put on treatment as soon as possible. And that treatment applies to who? That sort of pre or early treatment would be to who? Not the general population. No, treatment of people who are infected with HIV. So the earlier that they're diagnosed, the quicker you get them linked to care and put them on treatment. We know that that's what actually saves lives and prevents this infection from spreading. Mm-hmm. And what about other treatment options? Are there any other treatment options? And did the price jump from $13.50 a pill for HIV treatment to $750 a pill? Did that influence any ways that people are being treated? Well, the there are other treatments for HIV that we're thinking about, and one of them is called pre-exposure prophylaxis, and that's where you give high-risk people, maybe men who have sex with men who have high-risk sexual encounters, we give them a medication daily to prevent them from getting infected. That's something new and innovative that we're going to see increasingly be used. With regard to the price change, that was not for an HIV-specific medication, but for a drug that's used for an infection called toxoplasmosis, which occurs in people with late-stage AIDS who end up getting what's called an opportunistic infection. So it wasn't, in fact, it wasn't impacting the treatment of HIV patients per se, but a very small proportion of them. And that actually underscores the fact you don't get toxoplasmosis if you're on HIV medications and you're well suppressed.
So get it taken care of early. Dr. Amish Adolja, thank you so much for the update.
Thanks for having me.
More than 188,000 people in the county are living with mental illness. In this first part of a three-part series, KPBS health reporter Kenny Goldberg takes a look at some of the challenges the system faces.
For our CBC, she's already had a CBC at the clinic.
If you want to get a sense of the problem, just go to a local hospital emergency room. It's a weekday afternoon at Scripps Mercy Hospital. Dr. Ronit Lev looks at a computer screen that lists all of the patients in her ER.
We have 55 people in our emergency department right now. I see there's 2 people here on a psychiatric 5150 hold. We have a person here with anxiety. If I scroll down, we could see here suicidal, 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 suicidal.
In a different part of the ER, Dr. Lev stands outside of a room that used to be dedicated to cardiac patients.
Now we've moved them upstairs and we have 4 dedicated beds in a locked area where we have psychiatric patients, and they're there 24/7 with a dedicated psychiatric nurse.
Lev says this room is full 7 days a week. Other psychiatric patients are spread throughout the unit. In the last few years statewide, the number of psychiatric cases in ERs has skyrocketed. In some places, 1 out of 5 patients has a psychiatric issue. The increase may be due in part to the Affordable Care Act, which has allowed millions of additional Californians to get Medi-Cal coverage. Lev points out ERs can handle psychiatric emergencies, but they're not designed for people who need continuing acute care.
It's a chaotic environment. There's lots of distractions. It's the absolute wrong place for a psychiatric person who's psychotic and gets to hear all sorts of voices around them.
Here's how the mental health system is supposed to work. People with mental illnesses can be treated at community clinics or doctor's offices. People in crisis can be stabilized at ERs and then discharged to psychiatric hospitals or other locked facilities that can provide acute treatment. Some of those patients may still need an extended period of care, for which there are long-term care facilities. The problem is nearly all of these places are full. That includes the county's psychiatric emergency hospital on Rosecrans Street.
Sharp Mesa Vista Intake, this is Kathy. How may I help you?
And Sharp Mesa Vista Hospital, the largest private provider of psychiatric crisis services. Mesa Vista's medical director, Dr. Michael Plopper, says the system doesn't have enough capacity.
So all of these places that we typically send our most seriously mentally ill are impacted. So we're backing up in the hospital because we can't find appropriate placements in the community. And then the emergency departments are having difficulty getting the patients into our facilities because we don't have the space.
Michelle Coy lives in the South Bay. She was diagnosed with severe depression when she was 16. In 2009, after going off her medication, Coy spent a month at Sharp Mesa Vista.
When you're in a manic episode, it's very intense. I didn't even know I was bipolar at that time, but I started like hallucinating, and I was hearing things and seeing things, and I was very delusional.
Coy was discharged and soon had another manic episode. She was admitted to another hospital and diagnosed with a severe condition called schizoaffective disorder. The hospital wanted to send her to the county's long-term care facility in Alpine, but there were no beds available. Her mom, Mitzi, says watching her daughter languish was horrible.
Bipolar depression it's overwhelming. And there's a lot of struggles in it. And I want the best for her, but you can't get the help.
Michael Plopper says it's a matter of misplaced priorities.
I think our most seriously mentally ill have not gotten the attention they need in this county. and we're suffering the consequences of that.
Tomorrow, we'll take a look at what the county is doing to improve services. Kenny Goldberg, KPBS News.
The annual Women Peacemakers Conference underway at the University of San Diego. Peggy Pico has a preview.
2 of the 4 courageous women accepted into the University of San Diego's Women Peacemakers program this year are here to share their stories of peacemaking and human rights activism. Judge Najla Ayubi of Afghanistan was forced out of her job by the Taliban, but later took public office to promote women's rights and education. Galia Golan of Israel founded the Jerusalem League and Peace Now, the Israeli peace movement. Welcome to Evening Edition.
Thank you.
Now, Najla, describe what happened when the Taliban forced you out of your profession.
Of course, when you remind me, I feel so painful, because when you have a career, you're a judge or you're an attorney, and you know your rights, but unfortunately you have been pushed home, not being part of the public life and part of the society. That was one of the bad experience and injustice that I faced in entire of my life.
You went underground for several years and then re-emerged and returned to your work in Afghanistan. What would you say the state of women's rights and education is in your country today?
Actually, after the fall of the Taliban, particularly building the Constitution of Afghanistan or having Constitution of Afghanistan, we guaranteed we have a guarantee of free education for women, and as well as women being part of the public life, particularly having equal access, equal responsibility in front of the law in Afghanistan. Now, currently, after the fall of Taliban, we have, I would like to say that this is one of our achievements. Out of 7 to 7.5 million children going to the school, about 38 to 40 of them are girls going to school. This is one of the achievements that we have got. And also the situation of women, particularly women's rights. There are domestic violence, there are sexual violence. All of these issues are happening, but still we are working hard to make it better.
Okay, and Galia, what got you involved in working with the peace movement, and particularly getting women involved with the peace movement?
Well, I felt very strongly that women needed a voice. Altogether, I think the peace camp is really designed, amongst other things, to give people a voice so that there is at least some way to convey to the government that there's a very large public out there that wants a peace agreement, that's opposed to continuing the occupation. And women in particular, I think, need even more to be heard, because we're not generally heard. The Army is a very central institution in the country because we're in an armed conflict all these years. And so the voices that are heard mainly are men's voices, men who have experienced the war. Not that women haven't experienced war, but they're considered, the men are considered the experts, the authorities on what is so central to Israeli society, security. And women need to have a voice, and our voice has to be heard. Certainly Resolution 1325 from the United Nations recognizes this, calls upon governments to include women in peace talks and everything connected with resolving conflict.
In speaking of which, and I'll start with you, Najla, what has been a peacemaker to you?
To bring the unheard voices onto the table, particularly looking at the women at the grassroots level, that they don't have access to the policy level. Bringing their voices at the policy level that's what I'm doing.
And what would you say, Galia, if I had to say you're a peacemaker, at least here at the University of San Diego? What does that mean for you?
Well, I'd like to be a peacemaker. That is to say, I would like to be able to make peace, to have it come. At this point in time, we've been at it for many, many years, and not very successfully, although I think we have a very broad movement, both of women and men, who are pushing for a peace agreement and an end of the occupation. So for me to be a peacemaker is simply to keep trying, and I think in many ways to try to create or recreate hope amongst both peoples, Israelis and Palestinians, that we can reach an agreement, that it's possible, and we're doing everything we can to get there.
All right. If you had to say in a word, this is a terrible thing to ask you so quickly, what would you say is the most important thing somebody in the U.S. can do to help move peace forward?
At least support Afghan peace process, but not own the Afghan peace process. Give the ownership to the people itself.
And you're nodding your head as well for that.
I think the most important thing that we seek from the United States is to press the government, our leaders, to make a genuine peace talks.
All right. Galia Galan and Najla Ayubi, thank you so much for this. I want to let folks know that they can talk with you and meet the other peacemakers at the Women's Peacemaker Panel discussion tonight at 7 at the University of San Diego's Peace and Justice Theater. You can also watch it online. More information at kpbs.org.
Another warm-up right into the weekend. Plenty of sunshine along the coast, upper 70s into the upper 80s. Even warmer for the inland valleys. Look at that, near 100 Saturday. Mountains warm as well, and back into the triple digits for the desert. You can find tonight's stories on our website, kpbs.org/evening edition. Thanks for joining us. Have a great night.